Hi, my name is Betsy Fernandez, and today I will be demonstrating how to take care of a tracheostomy tube. And the first thing I will do is check the patient's chart, look to see what the procedure is and what their limitations are. The next thing I will do is gather all my supplies and take it with me inside the room and perform hand hygiene. And in this case, we'll be using a face shield. So what I have here is a face mask with the face shield, and I will be putting that on now prior to entering the room, just so that I don't forget later on in the procedure. Oh. Okay. Okay, now that it is secure, I'm entering the patient's room.
No.
Hi, my name is Betsy. I will be your student nurse today. First thing I'd like to do is I check your ID badge just to make sure that you have the right information. You give me your hand and your first and last name.
John Doe,
Okay, and your birthday.
May 3rd, 88.
All right, John. So today I'll be taking care of your tracheostomy tube and your stoma. I do want to let you know that it might be an uncomfortable procedure, so if you feel any discomfort or you cannot handle the pain or anything, I would just ask you to raise up your hand for me. And at this time, I would ask the patient if they require any pain medicine, and I would administer that and then let that settle before performing the procedure. So, I want to perform hand hygiene and oh my goodness, give the patient privacy. And I would raise the bed to a comfortable working height and put the conscious patient in semi-Fowler's, which is at a 45-degree angle, in order to perform this procedure. Alright, I'm just going to uncover you just a bit. Okay? Alright, now that the patient is ready, I do have all my equipment set out, and I will begin by preparing the suctioning kit. So I would have a suction pressure device in which I would set to 150 mmHg to that's for a standard adult. I would set that and then test the suction by occluding the tubing and allowing the pressure to build up. Okay, and now that I have that there, I will get my suction catheter kit. It's not expired, opened, or damaged. Okay. You always want to fix things per needed. Okay. Now we have our kit. Let's open it. And this is a sterile procedure, so I want to make sure that nothing is tampered with. Have our gloves. I have my container, and I do want to make sure that I'm only touching the outsides of this box because I will be putting the saline solution in here. Okay. And saline solution in there. Okay. Okay, now that we have that out, that's prepared, I'm able to put on my sterile gloves. Honey, can you pause? Now that I have my sterile gloves on, I'll set it to the side so then I can put my new cannula on this surface. So, what I'm now going to do is get the suction tubing. I'm going to wrap this in my hand. Okay, I want to make sure that I at least have 10 centimeters out, because that is what I will be inserting into the stoma. Well, into the tracheostomy tube. So, with my dominant hand, I would coil it up, and in my non-dominant hand, now I will grab the suction tube, which we will assume it would be in this general area. I would grab the suction tube and put in my other suction tube. Alright? Now that that's in there, okay, we're going to get the tip of this and insert it into the tracheostomy tube. But prior to that, I would get my ambu bag and give the patient 3 to 6 breaths. So I would give 3 to 6 breaths. 1, 2, 3. Oh, I would do that with my non-dominant hand. 1, 2, 3. Okay, get my suction tube, and I would have my saline solution on hand. So we're just going to grab the tip, put it into the saline solution, and suction it by occluding intermittently the suction hole right here, and just go in quickly and to the predetermined length. So I'm going to ask you to take deep breaths as I'm inserting this tube into your tracheostomy tube. So, and then as it's in there, I'm going to come out in circular motion while intermittently occluding this hole. Okay? Wonderful. And then we would, I would leave this in here. Get my ambu bag and give the patient another 3 to 6 breaths. Now this procedure would look a lot cleaner being that we have the pressure tube and the pressure machine, but we're making work. So after 3 to 6 breaths with ambu bag using my non-dominant hand, I would go again, doing the same thing, asking them to take deep breaths and putting the tube to the predetermined 10 centimeters. And I would suction as needed, coming in and out. Okay? Wonderful. Okay? Now we are done with this. well, we are done suctioning the tracheostomy tube. Finally, we would want to go to the back, the oral pharynx, with this tube for final time. I'm gonna get my saline solution, put it all the way through the mouth into the oral pharynx, and just suction in there. Make sure we're getting all we can. After that, I would no longer put this into the tracheostomy tube. I'm done with this. I can take it off with my gloves. Okay. Now I can remove all my items. Okay. Okay, I would perform hand hygiene and make sure that the patient is comfortable. Are you doing all right, Mr. John?
Yes.
Okay, looking great. So now moving on to the next part of the procedure, I just want to make sure that the tracheostomy tube is out first. So I'm just going to take this out with clean hands. And discard of it. And with gloves and with my clean hands, I would open the new cannula and set it aside. Being that we might not have a new cannula, I would clean it with saline solution and make sure it's in a sterile field. Okay. Perform hand hygiene. Now we're going to open the tracheostomy care tray. Okay. This is also a sterile procedure. First thing I'm going to do is remove my gloves out of the packaging. I also want to put the saline solution in there. Okay. Also take out this padding and lay it across the patient's chest. Okay. Okay, at this point I can put on my gloves. Sometimes our gloves come in odd positionings. And I'll put that. No longer need this. Set that off to the side. I want to get my swabs and just let them sit right here in the saline solution. Okay, now what I would do is get my care tray, put it off the side right here, closer to the patient, and with my dominant hand, I will be cleaning in 4 sections the bottom of the plate where the tracheostomy tube goes. This is now my clean hand. So I would lift it just a bit and clean underneath in sections. And all we're doing here is cleaning the stoma. Okay. And with my gauze, I'll pat dry. Okay. Okay. Now that that procedure is over, I can remove my gloves. Perform hand hygiene and put on clean gloves. Okay. Now I can get my new tracheostomy gauze and put it underneath. Okay. Now I have that, and I would also put the change the straps of the tracheostomy device as needed, and in my new, I would also put in my new cannula. Okay. Making sure I clip the edges securely into the folds. Okay. Now that that is done, I would auscultate the lungs and listen for sounds. Make sure that everything has been suctioned out, and remove any equipment from the patient. Make sure they are comfortable. Return the bed to lowest position. Remove my gloves, perform hand hygiene, and thank the patient. And that is all. Thank you.